Here, at an impressive castle restaurant in Geneva, the not less impressive research report entitled Ending HIV as a Public Health Threat was presented to a remarkable group of experts, researchers and government representatives. The report by Caritas Internationals and the Catholic HIV and AIDS Network demonstrates that faith-based organizations give witness of being exemplary, efficient and effective.
They're really working with people and not just thinking about the disease. There are also organizations that really work with the culture of whether it's the town, the city, or the country in which people live. And it's so important because there's lots of different ways that we need to connect and make sure people are able to prevent themselves from getting HIV and getting the type of care that they need. And our faith-based organizations have been our steadfast partners in doing that over time.
We are here to share on research and documentation of the work that the Church has been doing in different parts of Africa and the world, which has been for a long time ignored and which has kind of been bearing fruit.
The report also mentioned those organizations that provide financial support for equipment and research, and that they rely on faith-based organizations which have the trust of the people who are living with HIV/AIDS.
Therefore, for an organization like the Global Fund, it's very essential that we partner with Caritas and other organizations so that the programs in the countries are successful. And the report shows that it has really worked. It has really worked quite well for millions of people and has saved millions of lives.
One of the research coordinators of the report emphasized that the look at several exemplary faith-based programs revealed that all of them approached the fight against AIDS in a holistic way.
And that has led to some really outstanding, sometimes over 90% retention rates, when many public health systems are 50-60%. So we know how to treat this, we know how to keep people alive and keep people healthy, and I think we have a lot to offer the world and to show and to now to document what we've done.
Other organizations might be able to give people pills, but they need more than that. They need to feel the dignity of being children of God. They need to be assured that God is not punishing them in any way, because God does not punish people with an illness. And also that they're created in the image of God, and that they then need to live in a responsible way so that they could fulfill the commandments of God.
And while the group had good reasons to celebrate their report that marks a new chapter, namely the beginning of the end of AIDS, a major concern still remains.
Without substantial investment in the AIDS response, we're not going to achieve our targets. And there is an important piece in the UNAIDS strategy that articulates that we have to actually front-load investments in the AIDS response in order to achieve the targets that we've set for the next 5 years, because then we have this narrow window of opportunity to turn the epidemic around. If we can achieve the targets within the next 5 years, then we can actually end AIDS as a public health threat by 2030. But if we don't see the necessary investment in the next 5 years, then we will be living with the HIV response, and we will see a return to serious problems as similar to those we had in the 80s and 90s.